Irregular periods, 10 menstrual irregularities you should never ignore. Is your period playing hide and seek? Missing months? Showing up too often? Irregular periods can be more than just inconvenient. They can signal important messages about your body. Before we dive into 10 irregular period symptoms you should absolutely never ignore, please remember, this information is for general knowledge only and not medical advice. If you have persistent symptoms, please consult a healthcare professional. Science-backed resources are in the description below. Welcome back to our daily health. Ready to understand your cycle better and learn about potential warning signs? If yes, give this video a thumbs up and subscribe for more natural health insights. Your menstrual cycle is a vital sign of your overall health. When it's regular, it tells us things are generally in balance. But when your periods become irregular, it's your body's way of saying something might need attention. Understanding the different types of irregular periods and their potential causes is key to staying proactive about your well-being. This video will highlight 10 irregular period symptoms that warrant a closer look, using natural perspectives to guide your understanding. Number 1. Frequently skipped periods, missed periods. Consistently missed periods, 35+ days without menstruation, excluding pregnancy, breastfeeding, or menopause, are a key irregular period symptom, often signaling hormonal imbalance and lack of ovulation. Natural causes include chronic stress, elevating cortisol, thyroid issues, over or underactive, and significant weight fluctuations disrupting hormone production. This disrupted natural rhythm requires investigating underlying lifestyle and physiological factors. Prioritizing stress management techniques and ensuring a balanced diet can often help restore a more regular cycle over time. Furthermore, tracking your basal body temperature can provide insights into whether ovulation is occurring. Number 2. Periods that come too often, short cycles. Irregular periods with cycles consistently shorter than 21 days suggest a shortened follicular or luteal phase, often due to hormonal fluctuations, estrogen-progesterone imbalance. Insufficient progesterone after ovulation can lead to early uterine lining shedding. Inconsistent ovulation or an inadequate luteal phase might also be at play. Tracking cycle length is vital to identify this pattern and understand potential hormonal issues. Supporting progesterone production naturally through adequate sleep and managing stress might help lengthen the luteal phase. Consider incorporating foods rich in vitamin B6, which can play a role in progesterone production. Number 3. Periods that are too far apart, long cycles. Irregular periods with cycles longer than 35 days, oligomenorrhea, are often linked to inconsistent ovulation, meaning the body isn't regularly producing hormones to trigger predictable menstruation. Natural causes include PCOS, thyroid problems, hypothyroidism, and chronic stress impacting the HPO axis. Significant lifestyle changes, diet, exercise without enough nutrition, can also contribute as the body adapts. Gentle exercise and a nutrient-dense diet can often support more regular ovulation. Inositol supplements have also shown promise in supporting ovulation, particularly in women with PCOS. Number 4. Very heavy bleeding, heavy periods. Unusually heavy periods, menorrhagia, are abnormal menstrual bleeding often tied to hormonal imbalances, particularly excess estrogen relative to progesterone, leading to a thicker uterine lining. Natural conditions like uterine fibroids or polyps can also increase flow. Nutritional deficiencies, low iron, might worsen bleeding. Tracking blood loss is crucial, as persistent heavy periods can cause iron deficiency anemia, necessitating natural solutions supporting hormonal balance, such as incorporating iron-rich foods into the diet. Certain herbs like yarrow or shepherd's purse have traditionally been used to help reduce heavy menstrual bleeding. Number 5. Very light bleeding, light periods. Consistently lighter bleeding than usual is an irregular period symptom, hypomenorrhea, often suggesting low estrogen levels, which are vital for building the uterine lining. Extremely low body weight, due to restrictive eating or excessive exercise without enough calories, can also disrupt hormone production. Some natural remedies might subtly affect flow. Observing persistent changes in your typical flow helps understand potential hormonal or nutritional influences. Ensuring adequate caloric intake and supporting overall hormonal health through balanced nutrition are often beneficial. Consuming foods rich in phytoestrogens, like flax seeds, may also gently support estrogen levels. Number 6. Bleeding between periods, spotting. Any abnormal menstrual bleeding between regular periods, spotting or intermenstrual bleeding, is an irregular period symptom needing attention. It can stem from hormonal fluctuations around ovulation, slight estrogen dip. More frequent or heavier bleeding between periods might indicate minor hormonal imbalances, uterine polyps or fibroids, or even early pregnancy. Tracking the timing, color, and frequency of this bleeding helps understand potential hormonal shifts or uterine changes. Maintaining stable blood sugar levels and managing stress can sometimes reduce mid-cycle spotting. Avoiding harsh soaps or douches can also help maintain vaginal health and reduce irritation that might lead to spotting. Number 7. Severe period pain relief needed. Debilitating period pain, dysmenorrhea, interfering with daily life is not a normal part of the menstrual cycle from a natural perspective. It can be a symptom of natural conditions like endometriosis, tissue growth outside the uterus causing inflammation, or uterine fibroids. Inflammation in the pelvic region is a key factor. Stress, poor diet, and lack of exercise can worsen inflammation. Natural relief might come from heat, gentle exercise, anti-inflammatory foods, omega-3s, and herbs, ginger, chamomile. Persistent severe pain requires investigation for underlying conditions, and exploring natural anti-inflammatory dietary changes may offer long-term support. Magnesium supplementation can also help relax uterine muscles and reduce cramping. Number 8. Sudden changes in cycle length. A sudden significant shift in your typical menstrual cycle length without an obvious cause, like starting, stopping hormonal birth control, is an irregular period symptom indicating a change in hormonal balance. Consistent cycle length usually reflects hormonal stability. Abrupt shifts can be due to increased stress impacting the HPO axis, changes in sleep, significant diet exercise changes, or the onset of perimenopause. Noting these changes and accompanying symptoms can reveal the cause of the disruption. Establishing a consistent sleep schedule and managing stress levels are often helpful in stabilizing cycle length. Adaptogenic herbs like ashwagandha may assist the body in managing stress and its impact on the hormonal system. Number 9. Periods that last significantly longer than usual. Periods consistently lasting over 7 days are considered abnormal menstrual bleeding, suggesting the uterine lining isn't shedding efficiently, or other factors are at play. Naturally, hormonal imbalances, estrogen, progesterone, can prolong shedding. Uterine fibroids or polyps can also contribute. Blood clotting issues or nutritional deficiencies might have a role. Prolonged bleeding can cause fatigue and iron deficiency, emphasizing the need to understand and address the underlying natural causes through lifestyle and dietary adjustments, potentially including herbs that support uterine health, such as red raspberry leaf. Number 10. Absence of period for 3 or more months, amenorrhea. Going without a period for 3 or more months, amenorrhea, excluding pregnancy, breastfeeding, or menopause, is a critical irregular period symptom requiring attention from a natural health perspective. It signifies a significant disruption in reproductive hormones. Natural causes include chronic stress impacting the HPO axis, excessive exercise with insufficient calorie intake, and significant rapid weight loss. Underlying conditions like thyroid disorders or pituitary gland issues can also interfere. Identifying the root cause is vital due to implications for bone health, fertility, and overall hormonal balance, requiring a holistic approach considering lifestyle factors and potentially incorporating gentle restorative practices like yoga and ensuring adequate healthy fat intake for hormone production.